Hi, I'm Jeff, a registered nurse and a patient safety expert. But today I'm talking to you as an oncology and chemotherapy patient. In today's video, we'll be discussing the importance of keeping a Q&A journal for all your important medical appointments. The type of journal is really up to you and what you want to use. It could be a notebook, it could be a small portfolio. I have a couple examples here that I use. This is the one that I'm currently finishing my first year in. The reason I like it because it has this snap band here to kind of keep you where you are. But if I was going to go out and buy a new one, I would probably buy one that has a plastic binder in it so I could keep some of the papers and things that I need to keep with me. It's important to bring the journal to all your important appointments. I would say it's a must-have for your oncology or your other important consultant appointments. As a patient, I can tell you many times when you go to, for example, your oncology appointment, and you may be there for news on your progress. Once they tell you good news or bad news or not so good news, that's probably all you're really going to hear. And so what happens in the rest of the appointment is they start sounding like Charlie Brown's teacher, that wah, wah, wah. So you want to have your Q&A journal to help you record all your important questions and answers. So let's talk about a few important tips in your Q&A journal. First, you want to sit down and write out your appointments and your questions that you have. You don't want to try to do those based on memory. So I've written out a recent appointment with my oncologist, and I've written my questions out here, and I've left space for the answers. You want to make sure you date all your entries so it's easy to look back when you're trying to look for a conversation and answers by the date. Leave space for your provider's answers. Maybe you want to do it half and half, questions on the left, answers on the right, or you just do them underneath like I've done them here. For really important key appointments such as your oncologist, it's really helpful to bring somebody with you that can be a second scribe. What I recommend is you give them the set of questions that you're going to ask and have them write down the answers at the same time you're writing down the answers so you can compare those notes later. If someone cannot come with you, you could consider having a phone call, having that person call in and also record the questions and answers as long as you get agreement with your medical team on doing that. If you're a visual person, it helps to maybe have a drawing by the physician when they talk about the part of the body. Maybe you have a solid tumor, or they want to kind of show you what's going on. Just grab a piece of paper, have them grab a piece of paper and draw out what they're talking about. For me, it's about my pancreas, so I have them grab a piece of paper and kind of draw what's going on with the pancreas because I'm a visual person. If they don't have a piece of paper, just use the paper they cover the exam table with. Read the Q&A journal after your appointment. You may have additional questions later after you read it and go through it. As always, feel free to speak up and ask questions. Don't stop until your questions are answered. With all your appointments, don't forget to bring your bell for your little B moments. You always want to celebrate those small moments or those small wins. It could be an improved test result, or you're feeling better, or symptoms are being better managed. So you want to bring that when you have those things to talk about in your appointments. It makes you feel better, and the staff will love it. We hope that the tips about this Q&A journal have been helpful. Make sure to leave comments or suggestions below in the video, and we look forward to seeing you in the next video.